Hi, this is Janie Brandsma. This is the Project 1 on botulism. So a little bit on the epidemiology of botulism. It's a disease that occurs when an individual becomes infected with this bacteria C. botulinum. It is not all that common nowadays, with only approximately 110 cases per year. With modern day treatments, it only has a 5% death rate, but if left untreated, it has a nearly 100% death risk. Botulism can equally affect anyone, no matter their sex or age. Botulism is not an infectious disease, so it won't be really likely to spread into an epidemic, but there is a risk of it being used in a bioterrorist attack because a couple of countries have weaponized it. However, there have been no successful attempts of this occurring. There are a few main symptoms of botulism infection. One of the first symptoms that will appear is problems with eyesight. It may become hard to move one's eyes, double vision can occur, and the eyelids can droop. This is the beginning of the bilateral descending paralysis that occurs in patients. This is a flaccid paralysis, so muscles will weaken, causing the atrophying of muscles, and if not treated, it can lead to respiratory problems or respiratory failure. There are different ways to get infected with botulism, but I will be focusing on the most common types, foodborne and infant botulism. A foodborne infection is caused by improperly canned foods. If they aren't canned at a high enough temperature, C. botulinum will reproduce and contaminate the food that's inside. This is why it's very dangerous to consume foods from a can that is inflated. Infant infection with C. botulinum is most frequently caused by the ingestion of honey that is contaminated by C. botulinum spores. This ingestion will allow the bacteria to multiply in the digestive tract. In order to treat botulism, the antitoxin H-BAT must be used. It is formed by antibodies that have been cleaved and will then bind to free botulism toxin in the system. Because it won't bind to the toxins that are already attached in the system, the antitoxin won't heal the damage that has already occurred. With time, therapy, and supportive care, new neuronal connections will form, allowing muscle function to return. Recently, it has been shown that copper can help in the effects of botulism toxins. It functions by non-competitively binding to the toxin, which prevents the function. While this won't cure the infection, it will delay the symptoms. Just to go quickly over a little bit on Clostridium botulinum. It's a gram-positive bacteria, meaning it has a thick cell wall. It is one of the few bacteria that can form spores, characteristic of the Clostridium group. It's one of the reasons why it makes it such a dangerous pathogen. Spores are very hard to get rid of. It is an obligate anaerobe, which means it can grow really well in canned goods or in the intestines. It's a motile bacterium with the use of flagellum. The neurotoxin produced by this bacteria is known as one of the most lethal toxins in the world. It's estimated that only 1 gram of concentrated botulism toxin can kill over 1 million people. This bacteria has a low tolerance to acidic environments, which makes it less common inside canned fruits over canned meats or vegetables. They are also pretty sensitive to temperature, which is why it is necessary to properly heat up canned goods to the right temperature before sealing. Botulism affects the nervous system, so to begin I will go over healthy neuron physiology. Neurons function by the formation of a membrane potential with the use of ion gradients. The resting membrane potential of a resting neuron is around -70 millivolts. When there is an influx of cations, this will cause the cell to become more positive, and it will depolarize, which will potentially form an action potential. This action potential will travel down the axon onward to the next neuron to send a message. A response such as a muscle contraction will occur once the message has reached the target organ. Between two neurons is a synapse. The postsynaptic terminal will communicate with the presynaptic neuron's dendrites with the use of neurotransmitters. These neurotransmitters, such as acetylcholine, is stored in the presynaptic terminal in vesicles. Snare proteins found on the cell membrane and the vesicular membrane will aid in vesicle fusion and neurotransmitter release. This release of neurotransmitter relays the chemical signal to the postsynaptic neuron, and the cycle will continue. When a patient is infected with botulism, the toxin will enter the neuron at its terminal. The heavy chain of this toxin allows the toxin to be endocytosed. The cytoplasm is a reducing agent, so the light chain will separate from the heavy chain at its disulfide bridge. Once the light chain is released, it will function as a protease enzyme by cleaving the snare proteins inside the neuron. This prevents the neuron from releasing acetylcholine onto the next neuron in the pathway. This is what caused the paralysis of muscles in an infected individual. There are 7 different serotypes of the botulism toxin. Types A and B are commonly the cause of human botulism, so I will be focusing on them. I want to go over similarities between the types A and B. They are both metalloproteases that contain zinc on the light chain. They are formed of one polypeptide chain that weighs approximately 150 kilodaltons. The heavy chain and the light chain are linked by a disulfide bond, which subsequently stabilizes the protein. Now to compare the two toxins, botulism toxin A, once inside a neuron, will cleave the SNAP25 snare protein, whereas the botulism toxin B will cleave the VAMP-V snare. They will both cause the same effect by inhibiting vesicle fusion. Botulism toxin A is used more often in cosmetic practices, whereas botulism toxin B is used for treating muscular disorders. The botulism toxin A is slightly longer of a polypeptide chain, and it contains 2 disulfide bridges, whereas botulism toxin B only contains 1. This could be why botulism toxin A is more potent of a toxin than type B. The botulism toxin does have positive clinical uses by utilizing the paralysis effect. Botox uses the botulism toxin A in order to relax facial muscles and thus smoothing out wrinkles. It can also be used to treat overactive muscles in patients with cerebral palsy or muscular dystonia by preventing uncontrolled movements. It can have the same effect on smooth muscles, such as in the esophagus of patients with achalasia or in hyperactive glands. For over a decade now, the botulism toxin has been used to help sufferers of chronic migraines. The doctor will inject botulism toxin in order to prevent sensory neurons from relaying the message of headache pain. I personally have had this done, and it does work as described. Now, as a summary, I would like you to consider and compare the differences between a functioning neural pathway and one that is under the effect of the botulism toxin.